Good afternoon, everyone, and welcome to our webinar series offered by the National Collaborating Center for Methods and Tools. And this is our Spotlight on Methods and Tools webinar series. And today we will be hosting a webinar focused on the action framework for equity integrated population health status reporting. So just a few housekeeping items before we begin today. You can use the Q&A on the right-hand side of your screen to post comments and questions during the webinar. We just ask that you remember to please send questions to all. If you do happen to send them privately to the host, we will get them. But in an effort to get the questions to the right person, please remember to send questions to all. We've also posted some information regarding any connection issues or technical difficulties that you may have experienced or may incur during the webinar, and that message can be found also in the chat box to the right-hand side of your screen. After today, we wanted to let you know that the PowerPoint presentation in English and French will be made available on our SlideShare account, and the audio recording in English will be available on our YouTube account. Also in our chat, you will find shortly that a summary of today's webinar. Actually, it's already been posted, and thank you to Claire at NCCMT for posting that. We posted a link to a 4-page summary about the tool, the reporting framework, in the chat section. So if you did not receive or happen to miss the email yesterday with that link, the link has now been posted in the chat section, and you can access that summary. So just wanted to get a sense, and we're going to ask the group who's joined us today a few questions to get a sense of who has actually joined us. And so our first question, we would just like to know how many people are joining with you today. So is it just yourself or more of you on the phone at one point in time than just yourself? So thank you to everyone who is responding. And it looks like most people are responding that it is just them. We do have a few people who have joined in a larger group of 4 to 5, so that's really great, and a group that's joined with 1 to 3 people. So thank you again to all of you who are responding, giving us a good idea who's on with us today. So as I mentioned, this is a webinar within a series that highlights tools and methods available from our freely searchable database called the Registry on NCCMT.ca. And this is our sorry about that, I clicked too fast. This is our 28th episode, 26th episode, sorry, within the series. And in addition to the summary, the 4-page summary, there is also a link to the summary statement that is within the Registry of Methods and Tools, a 1 to 2-page summary, shorter, about the framework and its applicability to public health. And another polling question, we would just like to get a sense of where everyone is from today. So any provinces and territories within Canada, as well as outside Canada as well. So as people are responding, it seems that we have people joining us from British Columbia, Alberta, Ontario, Nova Scotia, someone joining us from outside Canada, which is really wonderful. So thank you to everyone for providing your responses to this polling question. And just to, if you're not familiar with the National Collaborating Centers, so the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers that is situated across the country and is funded by the Public Health Agency of Canada. As my colleague Susan will refer to in a few moments, here at NCCMT we focus on improving access to and the use of methods and tools to help move research evidence into decisions related to public health practice, programs, and decisions. And we are lucky enough today to have our colleagues from the National Collaborating Center for Determinants of Health joining us as well, co-presenting with us today. And as we speak about public health and the relevance of NCCMT to public health, we also do support many outside of public health. So we would like to get a sense of what sector that you are from, of those of you who are joining us today. So we do have public health practitioners. We have some people in provincial, territory, government, and ministry joining us as well today. So and also municipalities, so a really good representation of a wide range of people and sectors, so thank you for that. And on behalf of NCCMT, we're happy to welcome our colleague at the National Collaborating Center for Determinants of Health. So Leslie Dick is a knowledge translation specialist with NCCDH. And our Senior Knowledge Translation Specialist at NCCMT, Susan Snelling, we are happy to have her with us today as well to present on the action framework. So it's my pleasure at this point in time to turn over the presentation to my colleagues, and I will pass the presentation over to you, Leslie, to get started.
Great. Thanks so much. I appreciate that. Welcome, everyone. It's Leslie Dyke. I'm a Knowledge Translation Specialist, as Jennifer said, with the National Collaborating Center for Determinants of Health. And Susan and I are going to make this presentation. We're going to go back and forth a little bit, sharing different aspects of the tool. And one of the really, I guess, exciting things and why we're so pleased to be presenting this tool today is because it was a tool that was developed across the NCCs. The NCCs, all 6 of us, collaborated on some of the foundational work that went into this because we all saw the benefit of examining health status reporting, population health status reporting more closely in order to consider how equity can be integrated so that it would benefit the work that we all do from all of our different perspectives. Because as you know, equity is one of those issues that cuts across all of the work that we do in public health and all of the different focus areas. So we're going to be spending some time today sharing a bit of that work with you and discussing some of the implications and hopefully hearing from you about the implications from your perspective. So the objectives for us today are really twofold. One is to introduce the framework, and the other is to help you reflect on your role. We all use population health status reports in our work, and our purpose today is to share what we learned. That's the NCCs, and in particular NCC for Determinants of Health and Methods and Tools, to share what we learned about integrating equity effectively and how that led to the development then of the action framework. So we'll talk a little bit about that. And we hope that not only will you bring a critical eye to the next health status report that you use, but we're also hoping that you will potentially change the way you see your role specifically in population health status reporting. So we'll come back to that at the end of the webinar today. So just before I turn this over to Susan, I just wanted to mention for those of you that maybe are not as familiar with the NCC for Determinants of Health as you might want to be, I would really encourage you to go and visit our site where you'll find all kinds of resources focused on supporting action to improve health equity. And we've really targeted our resources to focus on public health practitioners at all levels, frontline all the way through to decision makers, but also the people who work in the research area. So Our audience is basically anyone who's engaged in public health, the public health system. And our focus is, of course, on social determinants of health and the resources that make it possible for everyone to achieve the best health outcome that they can, and decreasing the gradient. That's another really important part of our focus, which you can find more information on our website regarding. So that's a little bit about the NCCDH. What I'm going to do now is I'm going to turn this over to Susan so that she can tell you a little bit more about methods and tools and introduce you to some of the background concepts for our work today.
Great. Well, thank you, Leslie, and hi, everyone. It's Susan Snelling here, and happy to share with you a little bit about the National Collaborating Center for Methods and Tools. So as Leslie said, lots of materials on our website as well, so I'd encourage you to check that out at nccmt.ca. What you'll find there is all manner of resources that can help you to find and use methods and tools, hence the name, for moving research evidence into practice. So finding and using what works in public health and using that to make decisions about what to do. So there are lots of ways that those resources are delivered. Right at the top of this figure, you'll see the Registry of Methods and Tools, which is one thing you can find on the website. And as Jenny said, right to start us off at the top, these spotlight webinars, of which this is one of a series, the spotlight webinars highlight methods and tools that you can find described in the Registry of Methods and Tools. And just as today, you can find a summary and a description of the action framework for equity integrated population health status reporting that we're talking about today. But you'll find lots of other things too in the registry. Other things that you'll find on the NCCMT website are all related to helping you to find and use what works in public health. So lots of online learning. We do workshops, and we have helpful videos, multimedia resources. So encourage you to check all of this out. Now, one of the key concepts as we really start to focus on our action framework today is health equity. And I expect if you're coming to this webinar, you probably have a good sense already of what this might mean. One way to describe health equity, and this comes from work done by the National Collaborating Center for Determinants of Health in their glossary of terms. Health equity means that all people, and that might be individuals or groups or communities, have a fair chance to reach their full health potential and are not disadvantaged by social, economic, and environmental conditions. Now, equity matters to all of us who work in public health and lots of other fields too, for a few reasons. One is that the health gap between the richest and the poorest is widening. So already we have a sense that there is disadvantage related to social or economic or environmental conditions, which means that we're not in a state of equity. It's also not only the poorest among us that experience less than optimal health. And this is when we talk about a gradient, the effect of disadvantage can be seen at all income levels. So as income rises, health rises as well, but it's true in stages. So the importance of health equity is for everyone in the population. We also know that in terms of outcomes, in countries where the gap between rich and poor in terms of their health is smaller, that is that there's less of a gradient or there's less division, the overall population health is greater. So you see better health outcomes when there is more equity. So for that and lots of other good reasons, we want to think about how we can promote health equity in all of the work that we do. Now, another concept that I want to bring to your attention as we start to think about the action framework is what I'm calling purposeful reporting. And quite a few years ago now, I was actually part of the team at the Sudbury and District Health Unit that worked on these 10 promising practices to guide local public health practice to reduce social inequities. So in that work, we looked to the evidence to see what were some promising practices for reducing inequity at the local level. What could be done by local public health units, for example, to address equity. And one of those promising practices that we saw in the evidence was what we called purposeful reporting. So simple reporting on health status with an equity intent and an equity lens, that's the purposeful part, with that particular intent, can highlight the problems associated with health equity and can point the direction for more action. So it's a promising practice. We still need more evidence on how this works and how to harness the potential of purposeful reporting. But this concept of purposeful reporting has been something that certainly has come to my attention through this work. And it's wonderful for me to see that this concept of purposeful reporting has actually been picked up and has some legs. And now we're seeing this action framework that actually gives some more context and more direction to this somewhat general concept of purposeful reporting. So as we get into the action framework, I think you will see that the concept of purposeful reporting gets played out in quite a bit more detail as we think about what we can actually do with our population health status reporting if we take that purposeful, intentional approach to it. So I'll hand over now to my colleague Leslie to talk about some other concepts that were also relevant as we move to the action framework.
Yeah, great. Thanks, Susan. So I can't say how important it was for us to be able to access and use the work of the Sudbury and District Health Unit and that foundational piece where they described these promising practices. And one of the challenges that we took on at NCCDH was the challenge of taking these promising practices and finding the evidence that we could, or building the evidence so that we could actually call them best or better practices, or at the very least help people to figure out how they could use these promising practices in a really practical way. And one of our first attempts to do this was to address the idea of roles. So I'm just drawing attention to what we call our roles document, which is part of our Let's Talk series, where we investigate kind of the core concepts, the core aspects of implementing an equity approach within public health. So if there's any concepts in population, public health, and health equity that you want to explore, I'd suggest you start with our Let's Talk series because we explore a number of them. But this one was really focused on roles, the idea that public health, if we could articulate the roles that public health has in improving health equity, then that would provide a really strong framework for people on the ground, people like you, to be able to say, okay, well, what are we doing in relation to these four roles, and are we using them as effectively as we can? And as you can see, and we're not going to spend today talking about the other three, but you can see assess and report is one of those essential roles, and in fact, populational status reporting is, of course, a key component of the assess and report role. So that was that's one foundational document I think you might find helpful in situating the assess and report. Now, just as an aside, one thing that I would note is that assessing and reporting as a role does not sit by itself. And this is one of the things when we started to articulate the roles, we wanted to make really clear is that the public health cannot be successful unless public health takes an integrated approach and uses all the roles, because they all develop and support each other. And so that's going to be an important reflection for us at the end as we reflect on the framework. So I'd ask you to keep that in your mind when we come to the discussion section. So moving on, how did we get to the action framework? Well, we knew that assess and report was an important role. We'd articulated that. We knew that there was this promising practice around purposeful reporting and being intentional about talking about equity. But we didn't feel like we knew quite how to go about doing that. One of the things we did right away was we did a scan for populational status reports in Canada in particular, but around the world, and we took a look to see what reports looked like, how well they were integrating equity. Could we find any exemplars, any populational status reports that we could hold up and say, you know, this is a really powerful, well-done populational status report. And while we did find some reports, we actually didn't find a report that we felt was really the go-to report, I guess you could say, and to hold up. It seemed like people across Canada and around the world had strengths and weaknesses in their reports. So we thought, well, why don't we explore this further? And we compiled, put together a learning circle. So those of you that have been following our work over the past couple of years, you're probably familiar with the Learning Together series. And it was a series that was built around these once every 2 months discussions of 10 public health practitioners from across Canada looking at different aspects of population health status reporting and equity and exploring them. And we did background literature searches, we framed the question, we brought it to our group, we'd have these in-depth discussions, and you can find those in this series on our website. But I guess the key takeaway message that came from that group, and this is a group that included medical health officers and epidemiologists, senior manager decision makers, frontline public health people from across Canada, from different size health authorities and health units. The takeaway message was a report that doesn't get used won't help us to advance health equity. So it wasn't, as a group, they weren't saying, well, we need the perfect data. Well, they recognize we're not going to get the perfect data. Or we need the perfect way to communicate it. Well, there is no perfect way to communicate it. We need to actually collect our data more often. Well, yes, but you know, when you put resources into collecting data more often, then that's resources that you don't have for something else. Or we need better resources at our national level. No, we need more local data. So those are all issues that are embedded in this idea of health status reporting. But bottom line, especially for people who are interested in equity, it's around the social changes that are going to make it possible for us to actually change, actually address these differences that are unfair and unjust. So the action concept was really, really critically important. And that really set us on the path for thinking about, well, how do we move from just thinking about populational status reporting as a report and the technical information or approaches that need to go into it, and how do we do a better job about thinking of health status report as something that needs to result in action. And interestingly, this is a focus that's really been getting a lot of traction around the world. People are talking a lot more about the fact that it's around the change that we make. And the challenge for us then as a knowledge translation unit is how do we move to solutions from the data? That continues to be a key frustration for public health. We would hear that over and over again. How do we take this data and make it do something for us? And we asked ourselves, well, is there something about the report and the reporting? It's really a reporting process that we could do that would actually make it possible and more likely that the information would get used. So, for example, if we only report on health outcomes and behavioral risk factors and we don't report on, for example, social determinants and then, of course, social policies, which would be, you know, the causes of the causes, we won't be able to frame the solutions to include solutions that are outside of the health sector, because ultimately we're looking for system change. And so I think that I'd really encourage you to read this paper that we've cited here, but I think that the point is well taken, that the result of the traditional way of doing our populational status reporting is an overemphasis on medical and public health solutions and not looking at the public health role in generating and supporting the broader solutions, those solutions that will actually result in system change. So as I said, we had a learning circle project. We brought people together. Then all the NCCs got together and said, well, let's find out if what we learned in that project and the framework that seems to be emerging is making sense. So we did a series of stakeholder interviews at local, provincial, and national levels. We've taken this framework to different conferences. We've done a webinar on this framework, and ultimately we've collected feedback from over 100 public health stakeholders. So if anyone's on this call, on this webinar, who's been, again, following this work, you've probably actually had a role in getting the framework to where it is now. So it's looking quite different than how it used to look, which is quite exciting. So I'm going to pass it back over this conversation back over to Susan so that she can pick up on the framework itself and start describing it so that you can get a sense of where we've got to for any of you that maybe haven't been following quite as closely in the process.
Thanks, Leslie. So what we're going to do over the next few slides is show you the framework, but also unpack some of the aspects of the framework. And one of the key things to notice is that knowledge mobilization, that is, using the knowledge that we gather for action, is at the core of this model. So that intent to mobilize knowledge for health equity promoting purposes actually has the potential to be transformative. So as we bring a health equity lens explicitly into our population health status reporting, it actually changes the way we do public health status reporting. And so if you think back a couple of slides to the roles document or diagram that Leslie showed, assess and report is one of those essential roles in improving health equity. It's also a really core role for people who work in public health more generally. So knowledge mobilization is at the core. The other thing to remember is that it's not only about finding and using the knowledge intentionally, but that feeling of mobilization really has a sense that there are people doing that. It's not knowledge that kind of sits back and, you know, as we say, sits on a shelf. For it to be mobilized, there almost has to be some sense of a person or people doing that mobilization. And so there's a real sense of activity as well, or action at the core. So bringing in this sense of roles and who does what and who can be involved perhaps is transformative as well to what we traditionally think of as population health status reporting. So here's the actual framework, and as I said, we're going to unpack the parts of this a little bit. Now, Leslie mentioned that it might look a little different if you've seen previous versions, and that's because we've done consultation and we've heard from people and we've made modifications accordingly. So this is the current version of the action framework, and we feel pretty happy with it at this time. So it's adapted from a similar framework from the Robert Wood Johnson Foundation program called County Health Rankings and Roadmaps, Building a Culture of Health, County by County. So that was really informative and influential to the work that we did. And also the NCCMT Evidence-Informed Public Health Wheel. If you're familiar with that, you'll recognize some elements here for sure. So the purpose of the framework is to describe the elements that are necessary for effective integration of health equity into population health status reporting. And our objective here is to do things that are likely to result in action. So that knowledge mobilization piece. And specifically, action related to addressing inequity. So the elements are part of a system and they work together, but just for the purposes of explication, we're going to pull them apart a little bit in the following slides. So I'll just go back one and say that these concepts that I'm going to unpack are in the pink circle around the edge, exactly same piece describing the reporting process showing up here. So we'll start sort of at 11 o'clock if this were a clock, but it really is intended to be a cycle, so wherever you're picking up, that's okay. It's not intended that you have to start in one place. And in fact, depending on the roles that you have, which we'll get into shortly, your role may not be to start at the place that everyone else starts. But for argument's sake, I'm going to start with prepare. And typically when we do population health status reporting, which is something that I've done and worked on teams with for much of my work in public health, we do have that sort of preparation kind of stage where we look to see what our key question is, what our problem is, and then we move around that cycle to find the evidence and assess the quality of the evidence. We synthesize that evidence and we adapt that to our local context. We report on it, and then we use it for something, hopefully something that would actually lead to action or decision. And then we often evaluate how our health status reporting was, how efficient we were, what kind of feedback we got. So that's a pretty typical process of public health status reporting. What we're seeing here that's been brought into this process is that integration of equity concepts. And if you look at the full equity the document or the summary, what you'll see is equity questions at each of these 7 steps that prompts you in a way that if you've been doing, shall we say, traditional health status reporting, you may not necessarily have thought about these pieces. And if you're coming more from the equity side of things, this may help you to think through what does it mean to integrate equity into public health status reporting. So for example, if you're thinking about that prepare step, you might be asking when you bring an equity lens to it, who needs to be part of our process? Often when we think about health status reporting, we think, well, we'll have the epidemiologist do it if we have one of those on our staff, or a data analyst, or someone who tends to play that role. But if we bring equity in, we may bring in other stakeholders who can speak to the meaning of health status in their communities, for example. So we start to, at the prepare stage, start to think about who needs to be there. And if you look at the report, you'll see other questions that might be asked at this stage from an equity lens point of view. As we move to search, from an equity perspective, we might ask a few more questions about what indicators would be most helpful in answering our research question or exploring the nature of the health status that we want to understand. So for example, we might start looking more for indicators that talk about assets and strengths in the communities. Health status reporting has tended to look for problems, risks, deficits. That's not always true, but there's certainly been that sense that we have been interested in uncovering problems so that we can do something about them, which is very good and warranted and has been really helpful. But from an equity point of view, we may also now be interested in understanding what are the assets or the strengths in a particular community that we could harness for action purposes. As we assess, normally we're thinking about the quality of the data that we have access to, but from an equity point of view, we may also ask, how do our research approaches and the data that we're using and the analysis that we do, how do those things integrate health equity values? What questions are we asking when we're assessing the quality of the data? For synthesize and adapt, we may start to think about the different types of evidence that we can bring in. So certainly statistics will be helpful, and that's the most traditional approach. But sometimes we may also want to bring in stories that will help us understand the evidence in the context of our local communities. As we get to the actual report, we always think about who's the audience. But when we're thinking about this from an equity point of view, the audience or audiences may differ, or it may expand our sense of who would be most likely or most important to be taking action around the findings that we generate. As we're implementing actions out of our report, we may ask, how can we collaborate with stakeholders, with various communities within our communities to implement those actions? We can't do it ourselves, and so we need to think about who else we bring in. And then evaluating. Normally when we do a health status report, we may have a debrief. We may ask ourselves, how useful was that report? We may think about the feedback that we got. From an equity point of view, we may also ask, in what ways did increased community capacity to take action on the social determinants of health result from the process? So it's a similar process to what we may expect to see from population health status reporting, but it has that additional element of equity that guides some of the questions and some of our actions around all of these steps. So I have a poll question for you now, and I'll ask Jenny to bring that up, and then I'll pass it over to Leslie.
Great, thank you, Susan. And as I'm watching to see what people are responding to Susan's question in your organization, which of the steps do you currently have a role in? And just a reminder, you can select any that are relevant. You're not just limited to one question. As the poll is going, we see that some people have answered none of the above, actually. And I'm not seeing, we might be hitting a technical difficulty, and I apologize to everybody as I'm not, oh, there we go. Here we go. And so thank you for everyone's responses. So pretty much all of the responses are currently covered, so people are involved in all of these steps. And primarily I would say the only one that's probably not as much as the others is the implement step. And all the others are pretty much well covered and within a sort of even percentage. So thank you to everyone who has responded.
That's great. Thanks, Denny. And it's very interesting to hear that the implement is the one that maybe is not getting the same level of response, because one of the challenges in developing this framework was when we asked ourselves, well, what does it mean to actually implement a population health status report? I mean, if it's not actually prepare, search, assess, synthesize, adapt report, like if that's not the implementation, then what is this thing called implementation? And this actually really underscores how using an equity lens and identifying actions and change as a result of population health status reporting, as soon as you add that lens to it, then implement looks a lot different, because we're actually looking for the increased capacity and then the social changes in order to lead to improved equity. We're seeing that as the implement. And then as soon as you do that and you say that is implementing, well, then it changes the way that we in public health need to think about our work. So that is well described, I think, in this quote that we adapted from that same paper, Urban Health Equity Indicators. And the point that they're making here is that it's not a technical process for experts alone. It is an opportunity for the participatory approach. In this case, they're looking at participatory science policymaking and governance. In other words, the way that we approach the way that we implement or take action, and therefore the role of public health. And I think that's pretty critical. And this really gets at what I was saying at the beginning, is one of the outcomes from this webinar. We're hoping that you will take another look and think again about what is your role and potentially the role of public health in population health status reporting. Because if we're going to use an equity lens, we have to think about our population health status reporting role differently. So I'm going to now move into the center of what we call the knowledge mobilization core of the framework and just speak a little bit about that. Hopefully you can keep in mind the reporting process steps that sit around the outside. So I'm going to spend a little bit of time here before making a few comments a little bit later around what the implications might be. And we have another polling question for you as well. So just starting in the very, very center of the mobilization core, and that would be the where of population health status reporting. So reporting is a process. It happens in a location. And one of the interesting challenges for us was to think about, well, what level does population health status reporting that integrates equity happen? And of course, we all use these health status reports at national levels and at regional levels. When we start to get down to our local level, it's a bit trickier, and I'm sure there's going to be big differences. Those people that are participating today from very small communities and small health authorities compared to those that are participating. For example, I can see on the participant list some folks from Toronto, and so your experience of this will be quite different. So that right away is a challenge. But I think that paying attention to level is really important because, for example, when we talked at the local level with public health practitioners about this framework, it was like a no-brainer. We heard back public health practitioners saying, well, of course we need to engage our community, and of course if they're not at the table while we're looking at information and collecting information, then how are we going to get, you know, the important policing data or education data or, you know, some of those pieces of information that are important to help us understand what we may already have in our health system data. But when we asked that same question of our colleagues at the federal level, so at the Public Health Agency, there was a little bit of confusion, a little bit of, well, we don't actually work with the frontline people on the ground at the local level. So then we asked the question, well, who are the stakeholders at the federal level, and how are those federal stakeholders engaged in a population health status report at a federal level? Which I think is a way of looking at health status reporting that we've not really looked at before. And I think that's really worth spending some time at. If we want to mobilize knowledge and we want to do that effectively, we have to ask the question about where, at what level. And the context is critical because, as you can see, the outcome that we're looking for is that the community is better equipped to take action to address health equity issues. So if we're looking for a capacity change, we need to know capacity where, for whom. And so if we're doing national populational status reporting, how are we paying attention to national capacity? And then how does that then relate to the local? So I think our framework is bringing up some really good questions that we're going to have to spend some more time on, which we'll get to also around some of the research questions that we're supporting. So I'm going to move to the next part of the knowledge mobilization core, which is the who. And traditionally, I think, when we look at the way that we have thought about populational status reporting in public health, we tend to think about it as something that public health does. Excuse me. And I'm not quite sure if that's because a lot of populational status reporting is a direct result of legislation. And what I mean by that is that most public health acts in Canada require the chief medical health officer to actually report on the health status. And I wonder if, because that has been the core, we've not really thought about the fact that in order to mobilize knowledge, we need all of the stakeholders to be engaged at the beginning. That's a basic principle of effective communication and knowledge translation. Well, the same is true then if we take a report and we want to make it a strong reporting process. We need those stakeholders involved. So for this, we heard from practitioners who said, well, it's not just public health that's a stakeholder here. We have community partners that are stakeholders. So as I said, you know, if we want access to data like policing data, well, clearly the police are going to be one of our community partners because they're not only going to provide data, but they're going to help us figure out how we're going to take action as part of our reporting process. And of course, researchers. So, which is a really interesting question, and we'll come back to that at the end, around that action research piece and how we can do a better job of supporting action research as part of a really strong knowledge mobilization strategy. Now, that might be gold standard and, of course, not achievable in every context and every setting, but I think the point here is that the primary actors are at a minimum these three different collections of actors, and that we all need to be engaged in the populational status reporting process. And of course, if we do that, excuse me, we will see increased leadership capacity. So that might be an interesting way to evaluate our population health status reporting. We're not just going to evaluate the quality of the report, but we're actually going to ask questions around how do we evaluate increased community capacity, but also increased leadership capacity, which is a really different outcome from a population health status report than the traditional way that we think about outcomes. And finally, the last element of the knowledge mobilization core is the how. How do we do this? And this is where we focused on the elements that need to be in place in order for these partners to work at whatever level they're working at to be able to do effective equity integrated populational status reporting. The fact that there is no one-size-fits-all, that how applying a health equity lens, how communication, how collaboration is undertaken and looks will be different depending on partners and level, but all three of those elements need to be in place for effective knowledge mobilization. They're essential to the process. And you'll see in the full framework document that there's a collection of questions that we need to think about when we're thinking about undertaking and strengthening our communication, our collaboration, and how we apply a health equity lens. So I'm not going to go into those here. You can take a look at those yourself. But I would also draw your attention to another way to think about the outcomes from populational status reporting, and that is an outcome of intersectoral and interdisciplinary process is in place. That's something that we see in a way that perhaps we don't see in traditional population health status reporting, that we've got these processes that are undertaken and implemented, and that we're constantly paying attention to and nurturing, that is an outcome from an effective populational status report that integrates equity. So the other thing I want you to keep in mind is we're looking at not just effective populational status reporting, but we're saying populational status reporting that integrates equity, and that's why we believe that these elements are essential. So I am going to advance to the next slide because we have another question for you. And this question is around the knowledge mobilization core. So I'm going to turn this over to Jenny to bring up the poll and take us through the responses.
Great. Thank you so much, Leslie. And thanks to all who are providing some responses. And again, similar to the previous question, you can choose any that are relevant. And so as people are providing responses, I see that a large percentage are saying yes to collaboration, application of a health equity lens, as well as the public health actor and researcher. So community partner is a little bit less upon people's responses, but there is a nice range of people providing responses in each of these categories.
Great, thanks, Jenny. And so I want to encourage people to maybe in the chat box, can you put some comments around why perhaps community partner is not an aspect of knowledge mobilization that you have a role in? And the reason why I'd be very curious to see what you have to say about that, I'm curious if it's related to your particular job description. So is it because your job is very clearly, let's say, a data analyst, or your job is very clearly, a manager? You're not actually doing engagement with community partners? I'm really curious about that. And one of the reasons I'm curious about it is getting back to the 4 roles. So in public health, clearly we have a role in assess and report, which is we're talking a lot about today, but we also have a role in modifying and orienting interventions, which I'm going to be talking about in a little bit more detail when I use my friends at Toronto Public Health as an example in that excellent report, The Unequal City. But we also have a role in partnering across sectors and policy development. And that is critical to actually having a very strong populational status reporting process that integrates equity. So I'm just taking a look at the chat. And I'm not seeing.
If you look in Q&A, Leslie?
Yeah, so Leslie, someone has responded that personally not doing direct engagement, but others within my unit do. Someone else has responded, roles in the data analysis and not the people interacting with community partners. So far, just 2 of our attendees have provided. Oh, and there is another response in our Q&A that my role involves interacting just with people within my institution, not with people outside our institution.
Okay, thanks for those comments. So those comments actually sound very familiar to some of the workshop that we did that was largely epidemiologists. And there was a lot of conversation in that workshop. I think it was at Topic, and it was a couple years ago now, so in Ontario. And there was a lot of conversation about, well, it's not my job to do that work. And when I asked them, well, how does it fit with your department then? What's the role of your department? And it actually came down to that there wasn't a clear role. It clearly stated in the department such that it was, and this was basically the epidemiology data analyst world, there wasn't a clear expectation that there is going to be disengagement. It was really to provide supports to other parts of the health unit. And so then that brings up the question, well, how is the health unit and where does that responsibility fall? So I'm just going to leave that as a question because I think we're going to have to talk some more about that and what that looks like. But we're not going to do that right at this exact moment because we need to progress a little further so we can open things up for conversation. So I'm just going to advance to the next slide to just reinforce what Susan said, and that is that the purpose of this framework is to describe the elements that are necessary for effective integration of health equity, that is, most likely to result in action to improve health equity. It's about the quality of the data, and it's about whether we're using appropriate methods and measures, which of course we get into the nitty-gritty detail when we're talking to our epidemiologist colleagues. But it's about more than that, and this is meant to capture the essential elements, but it is a framework. And one of the interesting things at this point is this framework is based on what we heard people needed and wanted and what would actually result in the outcomes we're looking for. However, we have not yet had people attempt to apply this framework, evaluate how helpful it is for the actual implementation. So this is one of our motivations for doing this, this webinar today, was to say this is a tool that we're putting out there. It's based on evidence in that it's based on feedback and literature reviews and people's experience, but we haven't actually tried to take this framework and apply it. So we'd really like people to do this and to ask themselves some of the questions that we're going to need to ask in order to assess about whether this framework has been helpful to people. So, you know, for example, if this framework is applied, but, for example, only public health is a partner in it, does that mean that the outcomes are not effective, that we're not achieving equity, that they're not really helping us advance? Or can we actually implement an effective populational status reporting process that is only driven and delivered by public health? Another question that comes up for me is, well, what if we have all the partners, and so we've got the researchers and community partners in public health, and we go through this process and we communicate and collaborate and we apply the health equity lens, but what happens if in the reporting process we basically don't evaluate, or we don't think through the implement, or we don't think about how we're increasing capacity? Does that mean it's not an effective health status report, even though it's a beautiful report, if we don't complete that reporting process, all of the steps there? And that then brings up the question that I'd really like to explore further too, and that is the comment that I made around the level. So if we're using this kind of a reporting process at the local level, but it's not happening at a regional or national level, do we have an effective health equity integrated populational status reporting process in Canada? So what are the broader implications for us? So I want us to come back to that in a moment at the end when we talk about some of our learnings and proposed future research. But just before we get to that, I just wanted to basically do a shout out. So I know that there's some Toronto Public Health folks on the webinar today, and so this is really a shout out to them to recognize the excellent work that they've done in doing not just one Unequal City report, but doing a second report, a 2015 report, so that they could look at trends and changes over time, so that they could basically keep that conversation going, support the work that they're doing so effectively in many ways within Toronto Public Health, and to really give the recognition that even though it's not a public report, this workshop they did to engage their Toronto Public Health staff to find out how they're using the data from the report, that workshop they did, it's all internal. It's something that I was able to chat with them about, but it's not something that's been made available. But the fact that they even did it, I think, is really significant. And the learnings that they took away from it, I think, are going to be important for them to think about. And I'm hoping that there's some folks on today that are going to be willing to contribute to our conversation in just a few minutes when we open it up for questions and comments. because we'd like to hear more from you. But there is one observation that I would like to make. So when they were talking to their frontline, to their practitioners about how they're using this report, you know, they said things like better understand client population needs and planning their programs and services and better supporting health equity impact assessments, which anyone who's dialing in or participating from Ontario know that that's a part of a performance standard of the health equity impact assessment process in Ontario. So it's supporting that, which we could do a whole other webinar on the infrastructure that needs to be in place in order to best be able to use the information and data, which will take us into a whole capacity conversation, which would be fun, but not today. But I guess what I wanted to bring up was that when you look at the 4 roles for public health in taking action on addressing health equity, assess and report is one, which clearly Toronto Public Health is taking as a really important role for them, and as is modify and orient interventions. You can clearly see when you look at the feedback that they got on how the report is being used that it's around understanding clients and it's improving programs and services. And modifying and orienting interventions is a really important role, and it's the second role that I would note today. But I guess where I see the real opportunity is around the partnering across sectors and participating in policy development. Those are that's role 3 and role 4. And those roles are equally important, and I would argue in some ways even maybe more important. And certainly the folks at Toronto Public Health did hear from their frontline people that they're using this report to raise awareness, to engage community on advocacy issues, and the example of the living wage, the Board of Health endorsing a living wage was seen as directly linked to being able to provide this really high quality data that then they could really create the case and argue for that to be supported basically by the Board of Health. But I guess my question would be, if the report was undertaken in a way that engaged board members, engaged the municipal representatives, that engaged some of the community partners, would the other 2 roles be I guess, a little bit more clearly stated? Or is this a process? First start with the internal modify and orient your own interventions before you can then do a better job of partnering across sectors and participating in policy development. So I'm just putting that out there because I think that this is the potential of population health status reporting. It doesn't just support assess and report It doesn't just support modify and orient interventions, but it also supports those other 2 roles if we change the way that we think about and engage differently in our population health status reporting. So I guess that is the challenge that I would put out to all of us in the work that we do. So I am going to pass this back to Susan so that she can talk a little bit about what we've learned and some of the things that we're thinking about for future research, because not only do we want people to try out this framework, but we think that there's a real role for researchers to help us think further.
Thanks, Leslie. So as you can tell from the way that we're talking about this framework, is not only is it an action framework in terms of its orientation and its intent, but it's also an action framework because there's been a lot of action around it, and I think there's going to continue to be a lot of action around it. So, you know, we've seen different iterations of the framework, and now we're starting to really try to reflect on what we've learned from participating in all of this activity so far, and really not a sense that we've got it all figured out, but we have learned a few things. So maybe we're at the evaluate stage of our process, but it's a cycle, so there's still more work to be done. So one of the key learnings is probably not a surprise to any of you that there really is so much value in understanding the meaning and the relevance of the data in the local context for subpopulations. And to really do that well, we need to hear from people living in those population groups and who can shed some light on the meaning of the data that we're finding. Another point about roles, which we've talked about a fair bit. So to do a population health status report, we've tended to think that that's a technical task, and there certainly is a role for people with those technical skills that we traditionally associate with health status reporting. But there's also a sense that to have a more participatory approach throughout, not necessarily equal roles or similar roles, but involved roles in different ways, to think about not only the roles of epidemiologists and data analysts, but people working on the policy side of things, people who are expert at bringing those equity lenses, people who have the lived experience of living in poverty or living in a particular community. All of those are key contributors to an equity integrated process for population health status reporting. So what it means is that we're taking another look at monitoring and surveillance and how that may traditionally have been done and who has traditionally done that. And as we put that strong knowledge mobilization strategy at the core, that is that there is an intent to take action, there is a wish to reduce the disadvantage that may come with income, low income, or other determinants of health. If we are purposeful about our reporting, that allows public health status reporting to be a tool to drive action to improve health equity. So some cool things, I think, that come out of this. And that also leads us to thinking about where to from here in terms of the research aspect. So we have a couple of ideas about possible research applications of this framework. You may have other ideas as well, and we would love to see those pop up in the Q&A. So a couple of ideas that we have. We'd like to just understand and assess current population health status reporting processes being implemented by Public Health in Canada to look at both the process and also the outcomes. So are we seeing those action steps being taken? Are we seeing things like policy change actually resulting from or being influenced by this kind of equity integrated health status reporting? And also to think about standards or ways of describing population health status reporting that bring in those concepts of surveillance and data analysis, but also bring in these concepts of health equity and organizational objectives related to community capacity, for example, having the objective of creating or influencing healthy public policy. Can that all be part of what we understand to be population health status reporting? And there's a conceptual piece here that I think we've contributed something to, but there are probably also research applications of what really that would look like that would be exciting. So any researchers on the line, and we're all researchers, we'd be interested in your thoughts about these or other research questions. We do have a couple of suggestions for you if you're interested in this action framework and just maybe not quite sure what a next step might be. And again, these are just suggestions, and we'd be happy to hear from you in the Q&A about other ideas that you have about what this might mean for you or what you could do next. But depending on where you find yourself in that cycle of the reporting process that goes around the outside of the framework, if there's already a report, well, get a copy of it and meet with your colleagues to think about how equity has been integrated, and ask yourself some of those questions that the framework provides to say, well, have we done this, and could we do this next time, and might this be a next step for us in trying to bring action from our health status report. Maybe there's an opportunity to invite someone from the group that produced your population health status report and try to understand maybe what your role might be in terms of mobilizing that knowledge. Is there more that needs to be done to communicate and collaborate? Or can you simply learn from and understand what good work has already happened? And then if there's a sense of we're going to be doing some health status reporting and really getting to that prepare stage, maybe this is a time to really bring together that intersectoral group to talk about what it would be like to integrate equity into the population health status reporting process and be thinking about purposeful reporting right from the start. If we have an intent to make this health status reporting process useful for taking action, what do all of us need to do? What do all of us have to contribute? Are there people missing that we need to bring in so that we'll be more effective at taking action? Lots of questions that could be asked and lots of points in the cycle where you could be asking them. So it's not only to start thinking about integrating equity as you're preparing for a new health status report. There are ways to jump into this process no matter where you are around producing or having an existing population health status report. So some questions now just to get started, and happy to explore any other questions that you have as well on in the Q&A. So I've seen some questions come up already, and so I'll just pass it back to Leslie to start us off as we head to the discussion portion.
Yeah, thanks, Susan. And so there were three questions that I've seen so far in the Q&A, and a couple of them are fairly straightforward, and so maybe I can just start with the one. Yeah, I guess I shouldn't say it's straightforward. Okay, so one of the questions was, can you talk more about what you mean by health equity values lens? What does that look like? So the only reason I say that's straightforward, because it doesn't sound straightforward, does it, is because we actually wrestled with that, and you'll find in the framework that we describe applying a health equity lens as meaning asking questions that ensure differences in health status are assessed for fairness and justice. So these include questions about how we can ensure we're thinking about social, economic, and political structures and systems that create health inequities, as well as questions about how we can more fairly distribute resources for health. So that is the lens. And so the lens is really about the questions that you need to ask as you're thinking about whether you are integrating health equity. And the reason for that is because the process of thinking about what is fair and what is just is a values-based judgment, and therefore the only people that can answer it is the community. So we as a community of citizens, of engaged citizens, we're the ones who not only the standard for the legal standard for the community, if there's an emergency and you respond, what's it called, the Good Samaritan's Act, I think every province has one. As a Good Samaritan, you respond to the level of your ability and what is considered reasonable. And what is reasonable is based on, the community standard. We have those same standards with respect to, I believe, issues like that relate to pornography and explicit materials and things like that. That's all about the judgment, and it comes back to the community. And I would argue that, in fact, equity issues, so what is fair and what is just, it's the same. It comes back to the question of the community and what does the community see as fair and just. So by definition, then, public health cannot, quote unquote, decide themselves what is fair and just. We need to be considering that in the context of the community of which we're a part. And the other thing to think about there, too, is that it's systemic change that we're looking for. It's the system that we need to improve, which means we have to look at issues of power, and we need to look at issues of access to resources. So this idea of distribution of resources for health, whether it's individual abilities, supporting people to the level of their ability, or whether it's access to economic resources, those are all relevant, and we need to ask those questions. But I guess what I would put out there, or what I would ask is, when is the last time that you know, if you're doing the data analysis, when's the last time that you had that question around the public health ethics around, is the difference that you're seeing in your numbers unfair and unjust? And how are we actually talking about these numbers in a way that will result in a fair distribution of resources? And I'm going to suggest that that doesn't happen very often. So I'm going to be, I'd like people to add to the chat box around that. So that's the health equity values lens. The other thing to comment on, and again, just a brief answer, is the question around who's producing health status reports of jurisdictions that are better than most. So I would send you to the Learning Together series from our Learning Circle, because every time we asked a question around quality health status reports, we went looking. And so you will see all of the major reports, basically from every province in territory in Canada, referenced in those documents. Now that series is now 2 years, I guess, out of date, so there are a few newer ones as people start to integrate health equity. So I guess what I would say, and answer the question is, you know, there's our gold standards. I would say so far Toronto for sure, and Saskatoon is another one. But Montreal has done some amazing work. And there's a couple jurisdictions in Manitoba that have really powerfully integrated equity. The challenge is, of course, the operationalizing it and turning it into action. So when you hold it to that standard, it's really hard to find really, I guess, most powerful health status reports. So I direct you there. And then the third question that we had was, if possible, at some point, can we discuss the role of the LHINs in Ontario and the partnership with the public health units that's proposed? I would love for people to start to populate our chat box here with any comments you might have about that. And I think that probably assess and report and equity conversations would be a really nice way into thinking about what is the relationship between public health and primary care. And I would just also say, for those people that are not from Ontario, this is exactly the conversation that we're having in other parts of Canada in health authorities, as public health is being pushed to integrate more closely with primary care and to figure out what is the role of public health in primary care. So these conversations are happening all over Canada, not just the current conversation in Ontario around the LHINs. So. Yeah, so that's the answers to the questions that we had so far. I'm going to go back to the Q&A box to see if there's anything else. Susan, if you've seen anything, you want to jump in?
Yeah, well, maybe I'll just comment a little bit on the proposed connections of public health and LHINs in Ontario. And of course, you're right, Leslie, that this isn't like a really unusual conversation. It's happened in other places, but it's happening right now for us in Ontario. And I do think with respect to the action framework here, it really can maybe help us to see that as a bit of an opportunity. So not that LHINs have not done some really good work related to equity, and not that they don't have a good understanding of it, but I think for us from the public health world, we do bring an understanding of population health and the influences on population health that may be different from people who have worked primarily in primary care. And so people who work in public health also tend to have a pretty good understanding of community development, what it means to really connect with stakeholders. So these are not understandings that are unique to public health by any means, but you know, is there an opportunity for public health to bring some of that equity integrated thinking and action into the work that may be done with LHINs? I'd sure like to think so, and you know, that the transformative possibilities of what we're talking about with this action framework might also work to transform the larger system of health and healthcare in Ontario in this particular case. So that would be a nice outcome if that could happen, and I don't see why we couldn't make some headway in that regard.
Yeah, so Susan, one of the comments we had in the Q&A was just suggesting that maybe there's a research opportunity in this transition in Ontario.
What a good idea.
I know. Yeah. I think there would definitely be a research opportunity there that people should may be interested in pursuing. And so we had a couple other comments in the Q&A. We had the question of how do we know we're clear on equity and inequity related to application to the health status reports. And all I can say to that one, and then the following comment that was a comment around thanks, lots of judgment for fair and justice. Is fair the same as equal? This is very large, need good, solid community developers involved in this. And I think that both those questions are related. Equal is not the same as equitable. It's the judgment. It's that judgment as it's fair and just. And so who decides? And this, I think, gets at the heart of some of the issues that we're wrestling with in Canada around Truth and Reconciliation Commission and our relationship with Indigenous peoples. Who decides? Who decides what is fair and what is just? You only learn about that in conversation, in engagement, in relationship. So the same is true when we're doing equity work. We can't do equity work on people or for people. We have to do it with people. So another one of the comments that we got here was around the changing leadership capacity. You know, as a result of implementing this framework, where is the change in leadership occurring? Is it within communities or within the team that is working together to create the report, or both? And I think that because this work on equity is about what we do in collaboration, it's what we do in relationship, it changes all of us. And so the leadership capacity has to occur at the level of the individual who's contributing to the report, and hopefully the leadership capacity is those individual people representing public health and our community and our researchers coming together. But hopefully it's also the organization. And so that's the community capacity piece, because it's the way that we come together as a community that will result in the changes that we're looking for. So we need to come together when we're engaged in the reporting process, just as we do when we're trying to figure out, well, what are we going to do with this? And one of the things that I would put out there, and this has been something that has been an issue for me since I was working as a public health manager in public health in British Columbia. I was working, implementing population health promotion strategies for over 10 years within public health. And around data, it's related to the vital signs report. So one of the questions that I've always asked, and not always had a very positive response, is why are we doing, in I think it's 30-some communities across Canada, vital sign reports supported by United Way, which is a great report and brings people together in a really powerful way, and which quite often public health helps with. But why are those reports sitting there at separate in terms of the process from the population health status reports that our medical health officers and teams are doing in order to meet the requirements that a medical health officer has to do a report? One of my questions around the process is, and I've been asking this question for, I guess, probably maybe 15 years now, why are these not part of a similar process with different aspects and components that feed into each other in a more, I guess, systematic and systemic way? So that's just a really, really concrete example that I would put out there, that if we did our health status reporting differently, we'd likely change the way that we generated our reports, and it would have an impact on more than just population health status reports within public health, but it would impact other reports like potentially vital signs reports. And I'm not trying to pick on vital signs here. I'm just noticing and commenting. Oh, and Susan, it looks like in the chat you've got someone who says, hey, let's do it.
Yeah, talk about action framework. We're getting action right here, so that's awesome. Thank you.
Yeah, so it's just Jenny. I'm just cognizant of the time, so it's just a little bit before 2:30. And I just wanted to draw your attention, Susan and Leslie, to perhaps one last question that was posted in the Q&A. And Catherine was wondering, you'll see, regarding changing leadership capacity as a result of implementing this framework, where is the change in leadership occurring? Within communities or within the team that is working together to create this report, or both? So perhaps we could get your thoughts on this last question before we close up for the afternoon.
Yeah, so actually, Jenny, I just answered that question.
Thank you so much. Sorry, I was thank you.
You were multitasking, no doubt.
I was multitasking, looking at everyone's questions, so I apologize to everyone on the line. I just didn't want one to get left behind. Thank you.
Well, I think we're good. It's Susan here, but maybe I'll just comment on that too. So, you know, I know that all of us have had the experience of, you know, probably doing a great piece of work from our own perspectives, and then thinking, boy, you know, we really need someone to sort of carry this forward, carry this to the next step. And sometimes that's going to come within our team. But, you know, certainly sometimes it comes by, you know, a conversation that you have with someone who works at another agency, or, you know, some way that the work takes off in a new direction because it gets out into the community. So, you know, lots of examples that I can think of leadership, and I would say almost sort of advocacy in terms of taking action, probably can come at both of those levels. But, you know, as we think about the roles for public health, we also do want to think about where do community partners come into this, where do researchers come into this, and if we can really mobilize all of those players, so much the better for starting to think about where the action could come from. So easy to say, perhaps not as easy to do because there's so many priorities for people that we describe as leaders in our communities, but certainly that would be something to shoot for, is that we try to draw in those people who can bring this to the next level and have them think about what needs to happen next to improve equity in our communities. Thanks for these great questions.
Yeah, they're wonderful. So I'm just going to move us along to as we conclude, just again, keeping track of everyone's time. So I'll just move us ahead. And so I believe that there were some other resources available here at NCCDH for anyone else who is interested in some further resources. And you can contact both NCCDH and NCCMT here at their email addresses as well as the website addresses. And always welcome to follow both groups on Twitter. And we've already covered this, and it's been an excellent discussion, so I thank you to everyone. Echoing what Susan and Leslie have said, thank you for all your comments and questions, and for Susan and Leslie for their wonderful responses. And your feedback is quite important to us as this will be the last of our webinar series. We will break for the summertime, but as we begin to plan for next year, starting in September, with our methods and tools features, we'd really appreciate any feedback that you would like to share with us to improve our webinars moving forward. And just to sort of put a ending piece on this, just wondering what your next steps might plan to be. We've just suggested a few, and again, you can certainly answer more than one, but it would be good for us to get a sense of what your next steps might be. And seeing lots of people respond to read the summary about the action framework from NCCMT, but all of the responses are represented. So thank you to Leslie and Susan for stimulating action among this group. Quite exciting to see these responses and all responses showing up. So again, thank you on behalf of NCCMT and our Spotlight webinar series. I will just turn it over to Susan and Leslie if you have any golden nuggets or words of wisdom or any last-minute things that you'd like to share with the group before we conclude for the afternoon.
Yeah, I guess the only thing I would say is if anyone's experimenting with this framework, please let us know, because we really would like to know how useful it is, and we want to continue adapting it. So be in touch.
Yes, I'll echo that, and also just thank you to Leslie for her leadership on this project and framework, and for presenting with me today. And thanks to Jenny and the team at NCCMT for keeping us organized and keeping us on the airwaves. And thanks to the participants today. That was great to hear from you.
Great. Thank you so much, everyone. Have a wonderful afternoon. The presenters and I may just stay on the phone for a moment, but this will conclude our presentation today. So thank you so much.